How do molecular differences impact lymphoma treatment outcomes? Imagine your body's cells as a complex team, each with specific roles and instructions. When it comes to lymphoma, especially non-Hodgkin lymphoma, these cellular instructions can vary widely from person to person. These differences at the molecular level are crucial because they influence how the disease behaves and how well treatments work. Understanding these molecular distinctions helps doctors personalize therapy, aiming for better outcomes and fewer side effects. Non-Hodgkin lymphoma is not just one disease but a collection of many subtypes, each with unique molecular features. For example, diffuse large B-cell lymphoma is a common type that actually has several molecular subgroups. These subgroups are identified through gene expression profiling, which looks at which genes are turned on or off in the cancer cells. Each subgroup originates from different stages of B-cell development and is driven by different genetic changes. Recognizing these differences allows doctors to tailor treatments more precisely, rather than relying solely on traditional classification. Molecular differences impact treatment outcomes in several key ways. First, they guide the selection of targeted therapies. If a lymphoma shows overactivity in certain proteins or pathways, treatments can be chosen to specifically block those. For instance, some lymphomas have high levels of proteins that can be targeted by specific drugs, making treatment more effective. This approach, known as precision medicine, aims to improve cure rates and reduce unnecessary toxicity by avoiding treatments unlikely to work. Second, molecular profiling helps predict resistance and relapse. Some lymphomas express markers like CD20, which is targeted by monoclonal antibodies such as rituximab. However, resistance can develop over time. By analyzing the molecular makeup, doctors can identify patients who might need additional or alternative therapies to prevent relapse. This proactive approach helps improve long-term outcomes. Third, understanding molecular differences has led to the development of new therapies. Researchers have created drugs that specifically target molecular drivers of lymphoma, including small molecule inhibitors and advanced immunotherapies like CAR T cells. These options are especially valuable for patients whose disease has returned or not responded to standard treatments, offering hope for better results. Fourth, molecular subtyping provides important prognostic information. Some profiles are associated with better outcomes, while others suggest a more aggressive disease course. Knowing this helps doctors decide how intensively to treat and how closely to monitor patients, ensuring personalized care based on individual risk. Finally, integrating molecular diagnostics into routine practice is a challenge but also a vital step forward. It requires standardized testing, collaboration among specialists, and ongoing education. Since genetic alterations often involve complex interactions, predictive models are evolving to combine multiple biomarkers, giving a clearer picture of each patient's disease. In practical terms, two patients with what appears to be the same lymphoma might receive very different treatments once their molecular profiles are known. This personalized approach aligns with the broader goal of precision medicine, which aims to maximize benefits and minimize harm. It is important to remember that each person's disease is unique, and treatment decisions should always be made in consultation with healthcare professionals who can interpret these molecular insights. Overall, molecular differences are transforming how we understand and treat lymphoma. They help in making more accurate diagnoses, selecting targeted therapies, predicting how the disease will respond, and estimating prognosis. This progress is paving the way for more effective, personalized care that can improve survival and quality of life for many patients. Always consult with your healthcare team to understand how these advances might apply to your individual situation, as ongoing research continues to refine and expand these promising strategies.